Everyone feels sad, anxious, or confused at times. But when does normal distress become a mental disorder? And who decides what counts as abnormal? These questions define the field of abnormal psychology. Psychologists use 4 criteria to define abnormality, known as the 4Ds. Behavior is considered disordered when it is deviant from social norms, distressing to the individual, dysfunctional in daily activities, or dangerous to self or others. No single criterion is sufficient on its own. The DSM-5, published by the American Psychiatric Association, is the standard classification system used in the United States. It lists specific diagnostic criteria for each disorder, enabling consistent diagnosis across clinicians and settings. The DSM-5 describes over 300 recognized conditions. The biopsychosocial model recognizes that mental disorders arise from the interaction of biological, psychological, and social factors. No single cause explains most disorders. Genes create vulnerability. Stress triggers onset. Social context shapes the form and course of the illness. Anxiety disorders are the most common category of mental illness. They involve excessive fear or worry that is out of proportion to actual threat and causes significant impairment. The category includes generalized anxiety disorder, phobias, panic disorder, social anxiety disorder, and separation anxiety. Generalized anxiety disorder involves persistent, difficult-to-control worry about many areas of life, work, health, relationships, finances, lasting at least 6 months. It is accompanied by physical symptoms, muscle tension, fatigue, difficulty sleeping, and difficulty concentrating. The worry feels impossible to stop. Obsessive-compulsive disorder involves intrusive, unwanted thoughts called obsessions, followed by repetitive rituals called compulsions performed to reduce anxiety. The compulsions provide temporary relief but reinforce the cycle rather than breaking it. Common obsessions involve contamination, harm, and symmetry. Post-traumatic stress disorder follows exposure to life-threatening trauma. Symptoms include intrusive flashbacks, nightmares, emotional numbing, hypervigilance, and avoidance of trauma reminders. PTSD can emerge weeks or months after the original event and can become chronic without treatment. Major depressive disorder requires at least 2 weeks of depressed mood or loss of interest, plus several additional symptoms: changes in sleep, appetite, energy, concentration, or self-worth. It is one of the leading causes of disability worldwide and affects twice as many women as men. Bipolar disorder involves cycles between depressive episodes and manic episodes. During mania, individuals experience elevated or irritable mood, dramatically reduced need for sleep, racing thoughts, impulsivity, and inflated self-esteem. Bipolar I requires at least 1 full manic episode lasting 7 days or more. Beck's cognitive model of depression identifies a negative cognitive triad: negative views of oneself, the world, and the future. These automatic negative thoughts are not facts. They are cognitive distortions that feel true. Challenging them is the basis of cognitive behavioral therapy for depression. Schizophrenia is a severe psychotic disorder involving a break from reality. Positive symptoms add abnormal experiences, hallucinations, delusions, and disorganized speech. Negative symptoms remove normal functioning, flat affect, social withdrawal, and reduced motivation. Both types must be present for diagnosis. The dopamine hypothesis proposes that schizophrenia involves excess dopamine activity in certain brain pathways. Antipsychotic medications that block dopamine receptors reduce positive symptoms significantly. However, schizophrenia is now understood to involve multiple neurotransmitter systems and structural brain differences. Personality disorders are inflexible, long-standing patterns of inner experience and behavior that deviate markedly from cultural norms. Borderline personality disorder involves intense, unstable relationships and impulsivity. Antisocial personality disorder involves persistent disregard for others' rights with no remorse.